Hello and welcome. Today we'll be discussing peripheral ulcerative keratitis, or PUK, a serious eye condition that can threaten your vision. We'll explore what it is, what causes it, how it's diagnosed and treated, and what you should know to protect your eyesight. Peripheral ulcerative keratitis isn't caused by a single thing. It's often linked to underlying systemic autoimmune diseases like rheumatoid arthritis, granulomatosis with polyangiitis, formerly known as Wegener's granulomatosis, relapsing polychondritis, and systemic lupus erythematosus, or SLE. Infections, though less common, can also be a trigger. Sometimes the cause remains unknown, making diagnosis and treatment more challenging. Injuries to the eye, while rare, can occasionally lead to PUK as well. PUK involves a complex interplay of inflammatory processes at the edge of the cornea, the clear front part of your eye. Essentially, the immune system mistakenly attacks the corneal tissue. This leads to inflammation, tissue breakdown, and the formation of an ulcer. These ulcers thin the cornea, making it vulnerable to perforation, a serious complication that can lead to vision loss. PUK is relatively rare, which makes gathering precise epidemiological data difficult. However, it's known to be more prevalent in individuals with pre-existing systemic autoimmune diseases. Age and gender distributions tend to reflect the demographics of the underlying systemic diseases that are associated with PUK. So, groups more prone to rheumatoid arthritis, for instance, may also show a higher risk of PUK. The signs and symptoms of PUK can vary in severity. Common symptoms include eye pain, redness, light sensitivity, excessive tearing, and blurred vision. You might also experience a feeling of something being in your eye. A key indicator is the presence of a crescent-shaped ulcer at the edge of your cornea. Because it's in the periphery of the cornea, it is called peripheral ulcerative keratitis. Diagnosing PUK involves a comprehensive eye exam. Your ophthalmologist will carefully examine your cornea to identify any ulcers or thinning. They'll also inquire about your medical history, especially any history of autoimmune diseases. Blood tests are often ordered to screen for these underlying conditions. A corneal scraping for microscopic examination may be needed to rule out infection. While there aren't strictly defined types of PUK, it can be broadly classified based on its association with systemic disease. There is also a classification of infectious and non-infectious causes. The severity of the ulceration, its rate of progression, and the presence or absence of associated inflammation also play a role in categorizing cases and guiding treatment. The primary goal of treatment is to control inflammation and prevent corneal perforation. This often involves both topical and systemic medications. Topical corticosteroids can help reduce inflammation directly in the eye. Systemic immunosuppressants, such as methotrexate or cyclophosphamide, are frequently prescribed to suppress the underlying autoimmune response. In severe cases, surgical interventions like corneal transplantation or amniotic membrane transplantation might be necessary to repair or protect the cornea. Bandage contact lenses can also provide comfort and promote healing. While there's no guaranteed way to completely prevent PUK, especially when it's linked to systemic diseases, managing those underlying conditions is crucial. Regular check-ups with your doctor and adhering to prescribed medications can help control the inflammation that contributes to PUK. If you have an autoimmune disorder and experience any eye pain, redness, or vision changes, seek immediate medical attention. The prognosis for PUK depends heavily on the underlying cause, the severity of the condition at diagnosis, and how promptly and effectively it's treated. Early diagnosis and aggressive management can often lead to good outcomes with preservation of vision. However, delayed treatment or severe corneal thinning can result in corneal perforation, scarring, and significant vision loss. Recent research focuses on developing more targeted therapies to control inflammation and prevent corneal damage. Novel biologic agents and gene therapies hold promise for improving the long-term management of PUK. Continuous research efforts are also focused on uncovering the exact mechanisms behind the immune dysregulation to help with diagnosis and treatment. Always consult with your eye doctor for more information.